about, again, alcohol counseling and treatment, addiction counseling and treatment, diabetes education, management and intervention, and how about obesity care. None of that is different than smoking cessation. You may need some lab tests or some other things in terms of diabetes and obesity and maybe addiction. But again, the work that we're doing with the patient in person can all effectively be done over telehealth. And there's quite a few studies in all of these areas to show that clinical outcomes are better when patients have the ability to access care in a more convenient and easy and timely manner than driving someplace and having to get those services. So when we think about leveraging resources in our rural communities, for all of you in the public health sector, telehealth certainly can be that same tool for access that we see in the medical community in our clinics and hospitals. It can also really enable small communities to provide services that aren't available in those communities and help improve the health of the local population. Anytime you improve the health of the local population, you're also adding to economic stability of that community and assisting the local healthcare resources. What we find is employers who are sort of looking at moving into the rural areas or moving out of the rural areas, they will make those decisions dependent upon the amount of healthcare resources that are available in the community. If their population of workers has a high rate of smoking and they're a self-insured employer, they're going to be very interested in wanting to know how they can reduce the smoking rate in their population, particularly in the absence of no services available in the local community. So using telehealth in your practices will help enable those small communities to offer those services to their employers, to their schools, and also their constituents. When you think about where you could provide your services, certainly, and we talked about this earlier, schools, public health clinics, almost all of you are connected in some way to the statewide system. You could use that system if you have internet access. There's no reason you can't be providing telehealth services. It really comes down to public health is a great access point for people to receive all of the services that we've talked about so far. Enabling those clinics with telehealth so a client can sit down with in part calls with maybe a diabetes educator or an addiction specialist from Marshfield or Wausau or Green Bay is a perfect scenario and a perfect infrastructure to support leveraging your expertise in a way without the burden of actually driving somewhere and doing traditional outreach. And certainly think about local primary care offices. If those offices are enabled with telehealth, you can easily see patients in those locations as well. Again, that's the model we use. We have telehealth in almost a little over half of our primary care centers, our rural centers, and patients can access any one of those 45 different clinical services you saw on the first couple of slides. We have about 200 clinicians who use telehealth in their practice. So when you think about how do you do that, what does this look like? Well, we're talking about live video interaction. And these are where you're going to sit down in your office or in your location and have a video call, which is live, interactive, two-way audio and video with your client or your patient. You can do simply education events to a variety of locations. Let's say one of you is an expert in a certain area. You can broadcast that out, just like distance education, to multiple sites and have that an interactive event so that patients can ask you questions, clients can ask you questions, and they can work with you directly. You can also connect to family members. Again, family members can connect to loved ones who are struggling with issues and working with you. Or you can have a three-way with the family member and the client and yourself at the client's request. You can also do social networking. We're seeing a dramatic increase in the use of social networking in the medical community as an effective strategy in helping people change their health behaviors. If they are able to video chat or social network with another group of people like themselves, they opt in at their choice and really have a social network of people struggling with the same issues. And the last form of that is really the video consultations with clinicians. That can be clinician to clinician or clinician to patient, or it can be you with the primary care provider and the patient together. There's a couple of, so one of the ways to do this is with your own broadband proprietary network, which is expensive, but if your organization already has that in place for their IT infrastructure, their telephone system, and you already have internet access, it's not like you have to go out and buy something. If you have that in place, you're all already positioned to very effectively use telehealth as an outreach strategy. There are other very economical ways of doing this. There are third-party video companies. One of those is called Video, and this is just a subscription. It's a third-party server. You join. You have sort of like your own meeting room, and you offer that to your clients or your patients for their 2 o'clock appointment, and you meet in that virtual space. You can do this right into a client's home. You can do this working with kids, teenagers in school. You can connect to another public health office, again, a public health clinic, a WIC program, a parenting program. This is very, very economical. It's about $48 a month, similar to the program we're using now. Virtual Interactive Families is another company that was created by teachers so that families could connect. And again, this is very economical to use. All you need is internet access to do this. And the last way to do this is just simply with Skype. Now, you hear a lot of hype about Skype, and people are like, oh, you can't use Skype. You can use Skype. There's nothing wrong, illegal, immoral, unethical, and HIPAA violation with using Skype. The issue with using Skype is that people are nervous about doing that because you open up your network to be a little bit more vulnerable to hacking. But if you work with your IT system or you're using your own computer that's on the internet, Skype is a very effective tool to reach out to people as well. There's a lot of Skype being used in healthcare for telemental health, particularly to provide child and adolescent telepsychiatry because of the lack of the ability to connect with them on any other platform. Don't forget the value of tools such as MySpace, YouTube, and Facebook. People often get a little nervous about this as well. But again, if you're posting information, if you're coaching, you can have a MySpace site set up for, Dr. Antonetti's MySpace smoking cessation, and let people come in, let my clients come in and see things that I've left for them to read. Or, watch a short video that I put out there for them. Again, we're trying to create tools that are available the minute that patient needs something so that we can effectively interrupt the behavior that might not be as productive in terms of clinical outcome as if that patient didn't engage in that behavior. There's a system that's been developed, and we're sort of looking into implementing in a couple applications where through cell phone technologies and GPS, global positioning systems, we can tell if a person in recovery is walking too close to a bar every day. Let's say they walk from work to home, and now today they've changed their route to walk past the bar, but they make it home okay. And then tomorrow they slow down a little bit in front of the bar, but they make it home okay. We can sense that and track that, and that gives the clinician an alert to call that patient on the phone and say, okay, Nina, where are you right now? Oh, well, I'm just walking home. Well, you're not too close to the bar you used to always go into, are you? And what we're finding is just the ability to interrupt that thinking process and the behavior process is enough to keep patients on track. The other piece that's increasing significantly in terms of utilization on the patient side is applications. Now, you've all heard there's an app for that. Well, there's probably an app for just about everything. What we know is about 80% of clinicians are using some form of mobile device these days. They're not necessarily using applications as much in the healthcare industry, but they have a mobile device that they rely on some point in the day in terms of accomplishing their work. What we know on the patient side is that's a lot lower. But what applications can be used for in smartphone technologies and smart device technologies is for everything you see there on the list. When I think about your practices as smoking cessation counselors and social workers and diabetes educators, health coaching, medication reminders are two really important applications that have gained a lot of favor in terms of just, again, supporting patients at the time they need support, whether that's 11 o'clock at night, 2 o'clock in the morning, or at noon the next day. We know that we can get preliminary reads of clinical information. We can do visits, we can support, we can coordinate care, we can provide psychological support. One of the applications that Marshfield Clinic will be starting here in a couple of weeks is we're going to be pushing gaming out to kids, pediatric oncology patients, in order to help support their functional psychological status during times of stress. Social networking, and we already talked about GPS tracking, are very effective tools when it comes to the smartphone technology. The problem with the smartphone technology is only about 20% of people have smartphones. And when you think about this, just because your screen moves when you touch it and you have a touch screen on your phone doesn't mean it's actually a smartphone. The numbers are a lot less than what we think is out there. But what we know is the growth of health applications has dramatically increased. Most of what we call the early versions of applications started coming out in about 2007, 2008. And since that time, it's dramatically increased. So you can see just with the three different basically areas or companies, Apple, Google, and BlackBerry, growth 66%, 156%, 141%. And we know that a lot of these applications are health-related applications. And so the question really becomes, is the smartphone a platform that really might be effective in smoking cessation services or any of the other clinical services that we've talked about? Unfortunately, what we know about, and we'll just talk just about these smoking cessation applications, is that in 2009 there were about 47 smoking cessation apps. In 2010, that's doubled. The problem with applications in any venue is that very little of those applications hold to clinical standards. And what we know in 2009, according to just a review of those 47 smoking cessation apps, is that very, very few of them held up to the 2008 clinical practice guidelines for treating tobacco use and dependence. So that's a big problem in itself right there when you think about, okay, how do I effectively use applications in a practice to increase and leverage my experience as a clinician and get me to more places as an effective strategy for outreach. What the problem with the smoking cessation apps that were in place, and most of them that continue to be in place, is that few of them even recommend or link the user to proven treatment. So we're going to need to have a change in the way apps are constructed, written, and used. What we know about utilization of these particular applications is that when you look at them, most people were using them as a tracker device to look at how many times they were smoking in a given period. The next greatest usage was as a calculator in terms of calculating how much money have I saved since I stopped smoking. And I personally would probably think that people are using that as how much money would I save if I stopped smoking. There are some applications that are a tracker and a calendar together. That's the third largest utilization. And then some people, there's a handful of applications that provide hypnotherapy. That to me is really kind of scary, that I would be sitting someplace and hypnotizing myself with an application, and then, who's supposed to snap me out of it? So, obviously these are unregulated, and there's no way to really